Hey guys, Dr. Jason Torado here. Today it is What's Working Wednesday. So I'm excited to be back, excited to talk to you about our topic. And today's topic is going to be maintenance care. Maintenance care. Should we be offering maintenance care? Should we not be offering maintenance care? What is maintenance care? Well, let's kind of get started, right? Let's talk about just the validity of maintenance care. You know, um, Recently in 2011, there was some information that came out. Spine did an article on maintenance care as to whether or not maintenance care is valid. And for many, many years, I'll tell you something, I've been really wondering whether or not maintenance care is something that I should be offering it, should not be offering it. Uh, Only because I was wondering whether or not there was any research on it as far as whether or not it was justified. And I know Arthur Croft did some research on maintenance care with respect to healing from personal injury accidents like whiplash and soft tissue work. But in 2011, Spine magazine did some research on maintenance care, and they actually found out a bunch of things about maintenance care. And so one of the things that it really figured out was what they had concluded is that patients actually did benefit from receiving maintenance care treatments, and they believed that periodic patient visits had permitted proper evaluation, detection, and early treatment of an emerging problem, thus preventing future episodes of lower back pain. And so basically what they're saying is that maintenance care was warranted and maintenance care does work. So think about that, right? That really does give you the justification for recommending or it does give you the justification for offering maintenance care because it's something that's valid. You've got a 2011 Spine article there that basically states that that maintenance care does work. It can work. But the question is should you be presenting maintenance care to people in your practice that don't want it? I mean, should you be offering that? Because the bottom line is, if you're going to offer something that someone isn't really looking for, then it means you're going to have to sell it, right? And anything that you have to really sell in your practice isn't going to go over well. Just believe me, because it usually means that people don't want it. And so if you actually have to physically and verbally sell it, then it means that that could be a hard sell, because again, it's not something that patients are particularly looking for. Now, certainly you've got those outliers. There are patients out there that they want maintenance care. They want whatever you have to tell them. But you can't base a whole practice on what one or two patients, ideal patients, are kind of looking for inside your office, because that's not real. That's not the market. And don't get me wrong, when I first started chiropractic practice, I believed everybody should have been on a maintenance program, and I offered extensive maintenance programs. And I was told by my coach to offer a year of chiropractic care, and they should even refer in their family. I mean, I was really, really hardcore. But you also know that my first couple of years in practice, I mean, I suffered. I made a poverty level income. And it makes sense because I'm offering something that people just weren't looking for. And certainly my ideal, in my head, it was the best thing for the patients, right? But again, it wasn't what patients were looking for. So I actually had to get out of my way. But I know that even today, there's a lot of chiropractors that are out there selling maintenance care. And I know that there are a lot of coaches out there that are telling their clients to sell maintenance care. But you know what? On the flip side, I know that the majority of chiropractors out there that are doing that are also struggling. They're trying to sell their maintenance care programs. They're trying to sell their wellness care programs. And it doesn't work. It just doesn't work. And so that's why this topic of maintenance care is so important, because you can still have a maintenance care program, but not if you try to sell it or not if you try to force it down someone's throat. So remember that. The majority of my practice is a maintenance care program. Yes, I get a lot of new patients that come in. Yes, the doctors that I coach, they get a lot of new patients that come in. A lot of doctors that I coach, one doctor offices, they get 30, 40, even 50 new patients that come in every single month without even advertising. But you know what? They also have amazing maintenance care practices because they know how to keep a patient coming without having to sell maintenance to them, without having to force them to come in, without even have to ask them to come in. And I'm going to give you the secret on how to do that right at the end of this. But look, I think that patients, they don't know what they don't know. Okay. And so they don't really know the benefits of chiropractic. They don't know the benefits of long-term care. And of course I want to tell them that, and we can tell them that, but trying to sell them on something like that is something completely different. Why? Because patients are coming into your office for relief care. That's just what's happening. They want to get out of pain, and that's the reason why they came into your office. And you know what? That's probably an advertisement that they saw in Google. They probably saw your advertisement that said, come in for low back pain relief. Because even the best maintenance care, wellness, and even straight chiropractors out there, subluxation-based chiropractic, philosophy-based chiropractors are advertising low back pain relief, neck pain relief, migraine headache relief. It's all short-term care that they're recommending. Are they being hypocritical? Yeah, they absolutely are. It's almost like bait and switch because, and I don't want to talk bad about them, but I'm just saying they're doing what they need to be able to get people inside the office. They're advertising maintenance care. I mean, they're advertising relief care, headache pain relief, low back pain relief, neck pain relief. And then when they come inside the office, they're talking about subluxation. They're talking about, hey, we don't treat symptoms, or we need to recommend a maintenance care program. And so look, don't get me wrong. I believe that everybody should have some type of maintenance care. I believe my family is on maintenance care. I adjust them every couple of weeks or whenever it is that they need them. And so, but the problem is that you and I, we can't build our business on what we want. And we can't build our business by being right all the time. It just doesn't work like that. And so the idea is to be able to see more and more, more patients, not less patients. And that's how you build a business. And so trying to sell long-term care by overeducating, by breaking down your report of findings into a 2 and 3 and 4 day report of findings, or by making it mandatory to treat in your office that patients have to come to a healthcare class, and dropping hints as far as what wellness is all about, and mentioning maintenance care and wellness care on the first visit or the second visit, and even having posters up inside your office that say, maintenance care, and talking about wellness and talking about overall maintenance, chiropractic maintenance care. Like, those things don't work. They didn't work 100 years ago, 50 years ago, 10 years ago, and they still don't work now. Those doctors that are putting those signs up and that are putting in those subtle hints or are recommending that long-term care, which includes wellness and maintenance care, that just doesn't work. It just doesn't work. Now look, maintenance care is important. I mean, it's so important that Spine Magazine put out in 2011 an article stating that maintenance care works. And so absolutely, but those chiropractors that are trying to suggest or offer or force their patients to undergo wellness or maintenance care, and Mark, I remind you what I said was, even the people that offer, or the people that suggest, and then the people that force or make it mandatory, those doctors that are doing that, they're failing. They just are. And I've spoken to those doctors. And I'll tell a doctor, look, you're offering long-term care. And they'll tell me, no, Jay, I'm not. I'm just suggesting long-term care. I'm just suggesting wellness care. Well, you know what?